L-Thyroxin is a synthetic levorotatory isomer of thyroxine. Its action is identical to that of naturally occurring thyroid hormone. In small doses, it has an anabolic effect on protein and fat metabolism. In medium doses, it stimulates growth and development, increases the need of oxygen in tissues, stimulates the metabolism of proteins, fats, and carbohydrates, increases the functional activity of the cardiovascular system and the central nervous system. The therapeutic effect is observed after 7 to 12 days. During the same time, the effect persists after the drug is discontinued. Indications: hypothyroid states of various etiologies, including those caused by surgical drug exposure, prevention of recurrence of nodular goiter after resection of the thyroid gland, diffuse thyroid goiter, diffuse toxic goiter, after the creation of a thyroid state with thyrostatics, in the form of combined hormonotherapy, thyroid cancer after surgical treatment, to suppress tumor recurrence and as replacement therapy, as a diagnostic tool during the test of thyroid suppression, as part of complex therapy, Graves' disease, autoimmune thyroiditis. How to use? The daily dose is determined individually depending on the indications, the clinical condition of the patient, and the data of the laboratory examination. The daily dose of levothyroxine sodium is taken orally in the morning on an empty stomach, at least 30 minutes before a meal, with a small amount of liquid, half a glass of water, and without chewing. The tablet can be divided into 2 equal parts. When conducting replacement therapy for hypothyroidism in patients under 55 years of age, in the absence of cardiovascular diseases, levothyroxine sodium is used in a daily dose of 1.6 to 1.8 micrograms per 1 kg of body weight. In patients over 55 years of age or with cardiovascular diseases, 0.9 micrograms per 1 kg of body weight. The initial stage of replacement therapy for hypothyroidism, patients without cardiovascular diseases younger than 55 years. Initial dose: women 75 to 100 micrograms per day, men 100 to 150 micrograms per day. Patients with cardiovascular diseases or over 55 years of age, starting dose 25 micrograms per day, increased by 25 micrograms with an interval of 2 months until the normalization of the TSH in the blood. If symptoms of the cardiovascular system appear or worsen, correct the therapy of cardiovascular diseases. Recommended dose of levothyroxine for the treatment of congenital hypothyroidism. Age 0 to 6 months. Daily dose 25 to 50 micrograms. Dose based on body weight 10 to 15 micrograms per kilogram. Age 6 to 12 months. Daily dose 50 to 75 micrograms. Dose based on body weight 6 to 8 micrograms per kilogram. Age 1 to 5 years, daily dose 75 to 100 micrograms, dose based on body weight 5 to 6 micrograms per kilogram. Age 6 to 12 years, daily dose 100 to 150 micrograms, dose based on body weight 4 to 5 micrograms per kilogram. Age is greater than 12 years, daily dose 100 to 200 micrograms, dose based on body weight 2 to 3 micrograms per kilogram. Treatment of thyroid goiter 75 to 200 micrograms per day. Prevention of relapse after surgical treatment of thyroid goiter 75 to 200 micrograms per day. In the complex therapy of thyrotoxicosis 50 to 100 micrograms per day. Suppressive therapy for thyroid cancer 150 to 300 micrograms per day. Contraindications: hypersensitivity, untreated thyrotoxicosis, acute myocardial infarction, acute myocarditis, untreated adrenal insufficiency, should be compensated before starting therapy. Special instructions: in hypothyroidism due to damage to the pituitary gland, it is necessary to find out whether there is simultaneously insufficiency of the adrenal cortex. In this case, replacement therapy with glucocorticosteroids should be started before the start of treatment of hypothyroidism with thyroid hormones in order to avoid the development of acute adrenal insufficiency. It is recommended to periodically determine the concentration of thyroid-stimulating hormone in the blood, an increase in which indicates an insufficient dose. The drug does not affect the activities associated with driving vehicles and operating mechanisms. Side effects: tachycardia, violation of the heart rhythm, pain behind the sternum, tremor, anxiety, insomnia, hyperhidrosis, decrease in body weight, diarrhea, alopecia, dysfunction of the adrenal glands, with pituitary or hypothalamic hypothyroidism, a disorder of kidney function in children, allergic reactions, skin rash, skin itching.